Promise of hope. Bonheur Children's Hospital brings neonatal intensive care to Jackson-Madison County General Hospital. On a quiet morning in Jackson, Tennessee, the faint hum of monitors in the neonatal unit marks the rhythm of life itself. In one corner, a tiny heartbeat blinks across a screen, steady, strong, fighting. For the families gathered here, every breath is a miracle. And now, thanks to a groundbreaking partnership, those miracles have more support than ever before. Bonheur Children's Hospital, a nationally recognized leader in pediatric care, has joined forces with Jackson-Madison County General Hospital to bring specialized neonatal intensive care closer to home. The collaboration is more than a medical expansion. It's a lifeline for West Tennessee's most vulnerable patients and a beacon of hope for their families. Building bridges of care. For years, families in West Tennessee faced a heart-wrenching challenge. When newborns required intensive care, many had to be transported to Memphis, nearly 90 miles away, separating families during one of the most critical times of their lives. The stress, travel, and uncertainty often compounded an already fragile situation. Dr. Allison Reed, a neonatologist at Bonheur Children's Hospital, recalls countless nights seeing anxious parents waiting for updates after their newborns were transferred from Jackson to Memphis. You could feel the distance, not just in miles, but in the emotional strain it put on families, she says. Our goal was to close that gap. That vision has now come to life. Through a comprehensive partnership, Bonheur's renowned neonatal specialists are providing around-the-clock intensive care at Jackson-Madison County General Hospital, bringing world-class expertise directly to the community. The initiative ensures that fragile newborns receive top-tier care without having to leave the arms or the hometown of their families. The science of tiny miracles. At the heart of the new collaboration is the establishment of a Level III Neonatal Intensive Care Unit, NICU, at Jackson-Madison. This advanced facility can care for infants born as early as 28 weeks gestation, weighing less than 3 pounds. The unit is equipped with state-of-the-art incubators, respiratory support systems, and real-time monitoring technology, all standard at Bonheur's main campus in Memphis. But it's not just about technology. The partnership ensures that every nurse, respiratory therapist, and physician has access to Bonheur's extensive training, protocols, and expertise. Bonheur neonatologists will be on-site daily, while remote consultations and telemedicine links connect the Jackson unit directly to Memphis specialists for complex cases. We're bringing the best of both worlds together, local accessibility with academic-level care, says Dr. Reed. Families no longer have to choose between staying close to home and receiving the highest level of neonatal expertise. A human touch. For new parents, the first hours after birth are often a whirlwind of emotion, joy, relief, fear, and overwhelming love. When complications arise, those emotions intensify. Having immediate access to specialized care can make all the difference, not just medically, but emotionally. Laura and James Patterson of Jackson experienced this firsthand. Their son, Noah, was born 6 weeks premature. His breathing was shallow, and within minutes of delivery, nurses rushed him to the new NICU. Within moments, a Bonheur neonatologist was by his side. I remember seeing the Bonheur badge and just feeling this wave of relief, Laura recalls. I'd heard of their reputation in Memphis. They're the best of the best. Knowing that same level of care was here in Jackson meant everything. Noah spent 3 weeks in the NICU, gaining strength with each passing day. His parents never had to leave town or miss a feeding or a milestone. When he finally went home, the nurses who cared for him lined the hallway, clapping and cheering. It was a moment filled with gratitude, not just for a healthy baby, but for a hospital that believed in bringing care to the community. Training for the future. The collaboration also represents an investment in the region's medical future. Bonheur is helping train Jackson-Madison's nurses, respiratory therapists, and medical staff in the latest neonatal practices. Through continuous education, simulation labs, and mentoring programs, the partnership strengthens local expertise and ensures consistent quality of care. It's not just about sending doctors, explains Dr. Michael Roberts, chief of neonatology at Bonheur. It's about empowering a whole team, giving them the skills, confidence, and resources to deliver exceptional care right here. This emphasis on knowledge sharing means the program's impact will ripple beyond the NICU. Pediatric emergency departments, maternity wards, and even community pediatricians benefit from closer coordination and access to Bonheur's network of specialists. Community at the core. The partnership reflects a shared mission to serve every child with compassion and excellence, regardless of circumstance. Both hospitals are deeply rooted in community service and share a long history of supporting families through life's most critical moments. James Ross, CEO of West Tennessee Healthcare, which operates Jackson-Madison County General Hospital, emphasizes the importance of the collaboration. When a baby's life is in the balance, families deserve immediate, expert care, he says. By partnering with Bonheur, we're ensuring that families in West Tennessee have access to the same level of neonatal care as families in major metropolitan areas, without leaving home. The move also aligns with Bonheur's broader mission of extending pediatric expertise across the region. From outreach clinics to telemedicine partnerships, the hospital continues to expand its footprint in rural and underserved communities, ensuring that geography never determines the quality of care a child receives. A new era of healing. As the sun sets over the city of Jackson, the lights inside the NICU never dim. Nurses move quietly between bassinets, adjusting monitors and soothing tiny patients. Parents sit close, whispering lullabies, their hands resting gently inside incubators. There is a profound sense of hope, not just for the bobbies, but for the entire community. The arrival of Bonheur's neonatal program marks more than an expansion. It's a symbol of what healthcare can achieve when institutions work together for the greater good. It's a reminder that expertise, compassion, and innovation can meet in one place, and that place can be right here in West Tennessee. Looking ahead, in the coming months, the partnership is expected to grow even further. Plans include introducing advanced neonatal transport capabilities, allowing infants born in surrounding rural hospitals to be safely brought to Jackson's NICU instead of being sent to Memphis. Telehealth consultations will continue to expand, connecting families and pediatric specialists across the region. Ultimately, the initiative represents a powerful truth that every child, no matter how small, deserves the best possible start in life. And for parents in Jackson and beyond, that start is now closer than ever. As Dr. Reed puts it, watching over a room filled with soft beeps and gentle breathing, every baby here tells a story, one of strength, of love, of possibility. And now, thanks to this partnership, those stories can begin